Imagine a violinist in a large orchestra, where the whole ensemble is playing a magnificent symphony, but the violinist's instrument produces no sound and is muted. To express this in other words, the silence depressed me. It wasn't the silence of silence. It was my own silence. This reflection, reminiscent of Sylvia Plath's words in The Bell Jar, encapsulates the essence of depression as an internal silence. We will discuss the 5 most common signs and symptoms of depression and its most effective treatment and management methods. The first most common sign of depression is persistent sadness and a low mood. A person may feel sad, empty, and tearful, often due to low levels of serotonin and dopamine in the brain, which control mood. Serotonin is known as the well-being neurotransmitter, and dopamine is crucial for motivation, anticipation, and reward. The second most common symptom is a loss of interest or pleasure in activities once enjoyed, correlated with a lack of dopamine, which plays a significant role in motivation and reward. The third symptom involves changes in appetite or weight. Depression can cause increased appetite and weight gain in some individuals as they turn to sugary and fatty foods for emotional comfort, leading to weight gain. Conversely, others may experience a lack of interest in food and weight loss, indicating that depression can cause weight changes in both directions. Fourth, excessive sleepiness or the opposite, insomnia, is common, with individuals unable to sleep or maintain sleep. This symptom is also linked to hormonal and neurotransmitter imbalances during depression. The fifth sign is fatigue or loss of energy. Even small tasks may require significant effort for those experiencing depression, often due to low dopamine levels, lack of sleep, chronic stress, and hormonal imbalances. The most common cause of depression is genetics, with the condition running in families and being common among first-degree relatives. The second most common cause is changes in neurotransmitters, typically deficiencies in serotonin, dopamine, and norepinephrine. Third, hormonal imbalances can trigger depression, such as during puberty, pregnancy, the postpartum period, menopause, and thyroid problems. Fourth, important life events, such as the death of a loved one, divorce, illness, relationship problems, financial strain, or major life changes, can trigger depression in predisposed individuals. Finally, childhood traumas, such as physical, emotional, or sexual abuse, neglect, loss of a parent, or other adverse experiences, are significant causes. The first line of treatment for depression includes cognitive behavioral therapy, CBT, and interpersonal therapy, IPT. CBT is based on the idea that thoughts, actions, and feelings are interconnected, and changing our thoughts and behavior can alter how we feel. This is akin to cleaning dirty glasses to see the world more clearly. IPT focuses on the impact of our relationships and social roles on our mental health, with the premise that improving communication and resolving interpersonal conflicts can alleviate depression symptoms. Both methods are supported by evidence of their effectiveness, with around 70% of patients showing significant improvement after CBT and approximately 60% feeling better after IPT. Antidepressants like selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed. These medications, such as sertraline, Zoloft, fluoxetine, Prozac, escitalopram, Lexapro, venlafaxine, and duloxetine, increase serotonin and norepinephrine levels, significantly improving mood. Lifestyle changes, including regular physical activity, a healthy diet, sufficient sleep, and stress reduction techniques, can significantly impact symptoms and overall well-being. Mindfulness and meditation are also highly effective practices that help with depression. Mindfulness practices, such as mindful eating, involve paying full attention to the eating experience, focusing on the food's colors, textures, flavors, and aromas, as well as the sensations of hunger and fullness. This approach encourages eating without distraction, enhancing digestion, portion control, and enjoyment while reducing emotional eating. Supplements, including omega-3 fatty acids, S-adenosylmethionine, same, St. John's wort, vitamin D, magnesium, folate, and folic acid, and zinc, may also contribute to brain health, mood regulation, and the enhancement of antidepressant therapy, though their effectiveness can vary and some may interact with medications.